Good morning, everyone. Good morning, dignitaries on the dais, off the dais. I'll be presenting my views on health insurance, patient's perspective as versus clinician's perspective. No financial disclosure. Just to set the pretext of my talk, I did a small survey on the kind of how much health insurance is important. I took data from various types of eye centers to check the volume as well as revenue from various insured and empaneled cases. Like you can see data from standalone eye center where only two eye surgeons were there. Revenue from I took data, I compared data from for 3 months in various years. So revenue in a standalone eye center was 28% in March 2021, and in 2023 it was approximately 35%. Similarly, an eye center as a part of corporate chain in North India, it was 47%, 55 and 45% in various months, different years. From again, the data from large eye center as part of corporate chain, 42% and risen to 68% in 2023. And similar data was from eye center as part of corporate chain from Eastern India. The crux is basically what is the inference from this survey, that it was very obvious that volume and revenue from insured as well as empaneled cases from various government schemes, health schemes, it was significant in terms of volume as well as revenue, and it had showed northward trend. And definitely out of pocket cases are decreasing. So after this pretext, what does the patient want from health insurance? Patient wants services from a well recognized center which is providing high quality services. Patient wants personalized or customized services. He wants the highest the quality of consumables in ophthalmology. Most important, most common surgery is cataract, so highest quality of intraocular lens patient wants, and he doesn't want any co-payment, and he wants all the reimbursement for consultations, investigations and all other consumables, and he wants very less cool off periods. Though in ophthalmology this is not this concern is not very important, but for other services he wants higher category of room, and he wants cover for pre as well as post hospitalization expenses and no deductibles. And most of the times patients are not sure about terms and conditions of his insurance plan, so he wants transparency. And at the same time, what does clinician what do we want? We want best package rates for our services, and there should be very less documentation for pre-authorization of the insurance plan, and after the surgery for settlement of packages, the documentation again should be easy and minimal. And we also want complete reimbursement for all investigations, consultations and consumables, and we want the settlement to be done as early as possible after the surgery. Similarly, we also as clinicians, so many times we don't know the actual terms and conditions of patient's insurance plan, so we also want transparency of terms and conditions along with the patients. And what happens in the same area, for the similar surgery, different packages are there for different hospitals. So we want the similar packages in at least that area to reduce the competition in that sense. And how to create that win-win situation for a patient. If patient can buy a group insurance plan like corporate insurance, if we don't have corporate insurance, we can as patient we can club together and take a combined plan, and all better to take plan with higher sublimit. Like supposedly we have a plan of 5 lakh with Star Insurance, and the sublimit for cataract surgery is 25,000. We should bargain before taking plan that sublimit should be higher, not that low. Then before buying the insurance plan, inquire about deductibles and co-payments. The difference between deductibles and co-payments is deductible is the amount after which your insurance starts. Supposedly you have a bill of 1 lakh rupees and your deductible is 20,000 rupees. So insurance company will start reimbursing your claim after 20,000 rupees. So 80,000 will be paid by the insurance company, and the co-payment is it's in the terms of percentage. Like if it is 10% co-payment is your bill is 1 lakh, insurance company will pay 90%, 10% you have to bear. Like in another example, if bill is 1,50,000, in co-payment of 10%, insurance company will deduct 15,000. However, in deductibles, it will insurance company will give 1,30,000. Initial 20,000 insurance company will not pay. And a patient wants for elective surgeries, all elective procedures, insurance company does not reimburse the money before some period. Like for cataract surgery, in most of the insurance companies, there is cooling off period of 2 years. Only after 2 years, insurance patient can go for elective surgery like cataract surgery. Again, before buying the insurance, we should have knowledge of pre and post hospitalization expenses, and definitely if you want as patient, if you want cashless treatment, better to choose the center in network of that particular insurance. For clinician, few tips for the clinician. Definitely, if we can get our organization accredited with some known body like NABH, the empanelment is easy, as well as extra remuneration is also there for few cases. For example, in Haryana government gives extra reimbursement of 15% if NABH full accredited is there. Just I'll finish. And definitely bargain hard with insurance providers. You can take IOL exclusive as well as inclusive packages, and know the sublimit of insurance and bill accordingly the patient. Meticulous and thorough documentation should be there. And you should, as clinicians, you should know the process of settlement of so many insurance companies, they want hard copies also along with the soft copies. And while making bills, stick to the agreed tariff plans as per MOU. And just post text with I think it's not moving. Just go to the last slide, concluding. Just as post text, whether accreditation is required or not. Initially it was a must, but now after so many extensions, IRDA has given that it is not mandatory now. Insurance company can empanel hospitals even without NABH accreditation, but TPAs should they have their own standards, and they can conduct their own inspection. And there is recent development in insurance area that General Insurance Council has set up a committee to establish a common empanelment list and common rates for various procedures. That it should be same package rates for all the hospitals throughout the India. How successful they will be, the time will tell. Just as a concluding remark, nowadays insurance and other empanelments are not, it has not remained luxury, but it is our fight for survival, and our insurance company, we have to make it patient friendly, and documentation has to be thorough and meticulous. And now the dynamic will shift from a relationship where physicians and insurance companies are counterparties with competing interests. Now we have to move towards an association where our interests are aligned towards a common goal of improving health of the people we serve. Thank you very much, sir.
Excellent presentation, Dr.